Welcome to the General Departmental CSRAE New Grantee Orientation. My name is Julie Marchbanks from Public Strategies, and I will be the host for today. At this time, I would like to introduce Debbie Powell from Family and Youth Services Bureau.
Hello, I'm Debbie Powell, and I serve as the Deputy Associate Commissioner and the Acting Associate Commissioner for the Family and Youth Services Bureau, or FYSB. We lie at the Administration for Children and Families, and I provide senior leadership for 3 FYSB grant programs, one of which is the Adolescent Pregnancy Prevention Programs, also known as the APP program. On behalf of FYSB, and specifically the Division of Optimal Adolescent Development, where the APP programs are administered, we welcome you and are excited that you have joined us virtually for orientation for the new FY21 grantees. We are appreciative of your commitment to implement effective personal responsibility education programs and sexual risk avoidance education prevention services throughout the United States and U.S. territories. We acknowledge the challenges of delivering services during a pandemic. However, we are very happy and proud that grantees have continued to reach hundreds of young people given this monumental barrier. Many of you have proven to be tremendous leaders and advocates who have advanced FYSB's understanding and programming in the field. We are very proud to call you partners. I'd like to thank all of you for your hard work and your diligence in responding to our APP Notice of Funding Opportunity announcement in July, and commend you on submitting such thorough and well-developed applications. And it goes without saying, congratulations, not only on your successful applications, but in your commitments to foster the growth and success of at-risk youth in your communities. I'm very pleased to say that FYSB awarded a total of $52 million in SRAE and PrEP grants to 89 organizations that work every day to prevent adolescent pregnancy, and for some, to prevent sexually transmitted infections, including HIV and AIDS. We can't wait to see and help foster your success in providing effective adolescent pregnancy prevention programming to help prepare youth for a brighter future. Of course, you're already familiar with the APP program as evidenced by those applications, but today's orientation provides the opportunity to look closely at the inner workings of the legislation, the processes and practices for properly managing your grant, and the resources available to help you do so. There will be a lot of information thrown at you provided today, and it's essential for you to understand how and where it factors into your work. So get comfortable, be engaged, and ready for our question and answer period at the end of the presentation. Let me share a little bit of what will be presented to you during this orientation. We will introduce you to our awesome FYSB staff. We will provide an overview of FYSB and the APP programs and requirements. We will review the guiding legislation for your work, introduce you to training and technical assistance resources and partners, present an overview of the role of the Grants Office and resources that are available to grantees. Plus, we will show you some of the readily available tools and resources at your disposal, like the Exchange, which is an awesome interactive activation platform for APP grantees, partners, and stakeholders to help increase the visibility and impact of your efforts to prevent pregnancy among our most vulnerable youth. And last but certainly not least, the We Think Twice campaign, designed to promote healthy relationships, goal setting, and empowerment among youth. You'll also learn about the support that our team provides for building data capacity and local evaluations. We highly encourage you to conduct continuous quality improvement and local evaluations that will further our understanding of the anticipated outcomes and impact of your projects, and to demonstrate our projects effective. Once again, I am very happy to welcome you to the APP program. And remember, FYSB is always here to provide you the assistance, the guidance, the resources, and support you need to be successful in all aspects of your programs. Once again, congratulations, good luck, and thank you for your continued commitment to our youth.
Thank you, Debbie. And at this time, I would like to turn the presentation over to Ricky Richard, Federal Project Officer.
Thank you, Julie. Again, congratulations and welcome to the GDSRAE New Grantee Orientation. So again, my name is Ricky Richard and I'm a project officer in the Division of Optimal Adolescent Development and Support. At this time, I will be providing an overview of today's webinar, and additional staff introductions will be shared momentarily. So we do have a robust agenda, as Debbie has said, and so I'm going to be providing critical information on that. So we will start in the agenda with the overview of the Family and Youth Services Bureau, as well as the Adolescent Pregnancy Prevention Program. And then we will go into the general departmental funded sexual avoidance education program goals and objectives, followed by the APP program office roles and responsibilities, and then to the Office of Grants Management roles and responsibilities, the performance measures and evaluation, training and technical assistance, websites and resources, and at the end, it will be followed by a question and answer session. So now I would like to share a quick overview of the Family and Youth Services Bureau and the Adolescent Pregnancy Prevention Program, starting with the FYSB and APP program staff. So the APP program staff consists of Program Manager Labrita White, and then we have project officers Patrice Moss, Tanya Matthews, Letitia Winston, Jessica Johnson, Christine Secor, Kathleen Derrick, Brene Martin, Ricky Richard, myself, Latonia Cordier, Megan Hill, Alex Washington, and other important staff include our program assistant, Tarshika Thompson, and communications manager, Owen Burns. So the Family and Youth Bureau's and Youth Services Bureau, or FYSB, is located within the U.S. Department of Health and Human Services, Administration on Children, Youth, and Families. The Bureau is comprised of 4 divisions, and the SRAE program is administered by FYSB's Division of Optimal Adolescent Development. So here I'll talk a bit about the APP program vision and mission. So the vision is a nation in which all youth have the knowledge, skills, and support to make healthy decisions and successfully transition to adulthood. And the mission of our program is to work in partnership with funded states, territories, and communities to prevent adolescent pregnancy, STIs, HIV/AIDS, non-marital sexual activity, and other risky behaviors through engagement, empowerment, and holistic education. So the funding for this grant is provided through the legislative authority for adolescent pregnancy prevention in the section 50503 of the Bipartisan Budget Act of 2018 and extended by section 3821 of the CARES Act of 2020. So this funding year, 2021, there were 31 new SRAE grantees awarded $12 million. So here is just a chart of the funding year 2021 APP grant awards As you can see, there is a total of 275 grantee and grant awards in a total of $175 million. And in the GDSRAE category, this new funding year, there are 31 new grant awards at a total of, again, $12 million. So I'll talk a little bit more about the SRAE and PrEP programs. So APP takes a holistic approach to support state, tribal, and community efforts to promote medically accurate sexual risk avoidance education, abstinence, and contraceptive education, and adulthood preparation programming. The SRAE program implements evidence-based approaches that align with the needs and desired outcomes for youth and teach the benefits associated with self-regulation, successful sequencing for poverty prevention, healthy relationships, goal setting, resisting sexual coercion, dating violence, and other youth risk behaviors such as underage drinking or illicit drug use without normalizing teen sexual activity. And again, I'll be saying those different categories multiple times during this presentation. So now I will share the program purpose and requirements for the General Departmental Sexual Risk Avoidance Education Program. So here is the GDSRAE legislation. The legislation is provided on this slide, and it is critical that grantees ensure that all programming complies with the mandated requirements to include exclusive implementation of education and sexual risk avoidance, defined as voluntarily refraining from non-marital sexual activity. Other legislative mandates require that your program use medically accurate information, implement evidence-based approaches that meet the needs and desired outcome for youth, and teach the benefits associated with, again, those categories: self-regulation, successful sequencing for poverty prevention, healthy relationships, goal setting, resisting sexual coercion, dating violence, and other youth risk behaviors without normalizing teen sexual behavior. So here are the program requirements. So the SRAE program requirements include implementing curricula that include medically accurate information, reference and peer-reviewed publications by educational, scientific, governmental, or health organizations. And you should also select sexual risk avoidance curricula and/or strategies with an evidence-based approach to integrate research findings with practical implementation that align with the needs and desired outcomes of the target audience of youth. You should also teach risk avoidance skills through methods that do not normalize teen sexual activity and target youth populations that are at risk for non-marital sexual activity and other risky behaviors. And lastly, your program should ensure the program is inclusive and non-stigmatizing towards all populations. So here I want to talk a bit about the evidence-based or evidence-informed strategies. The GDSRAE program must, at a minimum, implement evidence-based programming. Selected interventions must be promising practices or have evidence of effectiveness with the target populations and adhere to the following requirements. Interventions must be: 1, they must be curriculum that systematically applies key program elements that have been found to be effective in positive youth behavior change. 2, link program participants to services with local community partners and other agencies that support health, safety, and well-being of program participants. 3, provide formal training for facilitators and educators in program model, elements of the program model, and youth risk and protective factors. And 4, teach the benefits associated, again, with those areas such as self-regulation, success sequencing for poverty prevention, healthy relationships, goal setting, resisting sexual coercion, dating violence, and other youth risk behaviors such as underage drinking and illicit drug use without normalizing teen sexual activity. So here are some key implementation topics that should be covered in your program. So all programs are required to follow the A through F topics as outlined in the legislation. Programs must teach: 1, the holistic individual and societal benefits associated with personal responsibility, self-regulation, goal setting, healthy decision-making, and a focus on the future. 2, the advantage of refraining from non-marital sexual activity in order to improve the future prospects and physical and emotional health of youth. 3, increase the likelihood of avoiding poverty when youth obtain self-sufficiency and emotional maturity before engaging in sexual activity. 4, the fundamental components of healthy relationships and their impact on the formation of healthy marriages and safe and stable families. 5, how other youth risk behaviors such as drug and alcohol usage increase the risk for teen sex. And finally, 6, how to resist and avoid and receive help regarding sexual coercion and dating violence, recognizing that even with consent, teen sex remains a youth risk behavior. So here I will talk about the positive youth development approach that SRAE programs must have. So SRAE programs must include PYD, or positive youth development approach, as part of any risk avoidance strategies. Typical elements of program models implemented with a PYD approach include ongoing structured activities that facilitate progressive skill building, positive interactions between youth, peers, and adults, and high levels of youth participation and engagement. SRAE programming must also be medically accurate and age appropriate. So SRAE programs must provide information that is medically accurate and age appropriate. Program participants should be able to distinguish between factual information and discussions of values and opinions that may be in disagreement with theirs. The programming must be culturally appropriate to ensure that the content is sensitive to the values and norms of program participants. And the requirements is that all materials mass produced for both the public and healthcare providers. So here you will see the medical accuracy review definition. And this definition is stated in the SRE legislation, as well as in the Notice of Funding Opportunity, or NOFO for short. It is key to ensure that the information provided to youth is both verified and supported by scientific research. So why are medical accuracy reviews important? So medical accuracy reviews are important for 2 critical reasons. Number 1, medical information is constantly evolving, and as new discoveries are made, program materials can become outdated. And so it is important to ensure that program materials are accurate, complete, and up to date when sharing them with youth. So some issues that may arise with medical accuracy issues, including the material may be inaccurate, incomplete, outdated, poorly referenced, or supported by non-scientific studies, and it may also be confusing and misleading to youth. So what will be requested of grantees to help ensure medical accuracy of program materials? Number 1, grantees should conduct an initial review of their program materials for medical accuracy prior to submitting to FYSB or our contractors, Gray Matters and Paltech. If your program is using materials that can be modified, issues found should be corrected prior to submission. Additionally, grantees are encouraged to independently review materials on a regular basis and make updates as needed. Based on past experiences, we have noted that during the review process that some grantees opt to select alternate curricula to ensure that the intervention fully conforms to program requirements and include medically accurate information. Reviewing the curricula and all other program materials carefully prior to the program implementation may make a difference in the interventions you ultimately choose to use in your project. For example, if you discover that there are major issues throughout the program materials and they require considerable modifications, you may need to consult with your federal project officer to explore other criteria and curricula. Number 2, grantees are to submit materials to FYSB, Gray Matters, Paltech for review when requested. Number 3, grantees are to respond to and address inaccuracies using various methods to include making modifications to the actual curricula text, creating an insert with updated information, selecting a different or supplemental brochure, video, handout, etc. to use, and consulting with developers on any significant changes in the curricula. And also to be of note, this month, November 9th, we will be hosting a medical accuracy review webinar to provide more detailed information on the process and instructions on how to submit materials. If you have questions prior to the medical accuracy review specific webinar, please consult with your assigned project officer. So here we'll talk a little bit about curriculum fit and selection. So as far as SRA curriculum requirements go, they should, number one, be age appropriate with regard to the developmental stage of the intended audience, culturally appropriate and linguistically appropriate. Two, they should be exclusive purpose of teaching sexual risk avoidance and the benefits associated with self-regulation, success sequencing for poverty prevention, healthy relationships, goal setting, resisting sexual coercion, dating violence, and any other youth risk behavior such as underage drinking and illicit drug use without normalizing teen sexual activity. Three, interventions, materials, and curricula must not promote or encourage sexual activity outside of marriage. Four, curricula, interventions, and activities can provide information on contraception that does not include demonstrations and/or simulations on contraceptive devices. So all SRE programs are to be implemented with fidelity. Fidelity is critical to ensuring the program is implemented without compromising the core elements of the curriculum that have been identified as essential for achieving program effectiveness. Fidelity plans and fidelity monitoring are effective tools to ensure that facilitators or educators are consistently teaching to the modules of your selected curriculum. SRAE programs may only provide education to youth on sexual risk avoidance. Funds may not be used to provide separate services such as healthcare, educational services, or career development. As needs are identified, grantees should provide referrals for necessary services, but may not pay for those services themselves with ACF funding. Next, I'll talk about the performance progress reports. The performance progress reports or PPR template was provided in your grantee guidance document emailed to you by your federal project officer and must be uploaded into Grant Solutions twice a year. Please refer to your notice of grant award and grant guidance documents for those dates. So this PPR report must address these areas such as major activities and accomplishments during the funding period, challenges, significant findings and observations, organizational issues, TA and training updates, and activities planned for next reporting period. So here I'll talk a bit about the post-award activities. So the post-award activities required for this funding include, number one, initiate full program functioning within 90 days of the award or no later than December 1st, 2021. You should also, number two, train facilitators/educators in program model or elements of the program model by professionals who can provide follow-up technical assistance to facilitators. Three, you should register and support attendance of at least 2 key staff persons to the three-day Adolescent Pregnancy Prevention Program Grantee Conference to be held in person or virtually in June 2021, and 2 topical training sessions offered each year in the project period. And 4, collect and report on Office of Management and budget approved federal SRAE performance measures. So we'll continue talking about the post-award activities. You should also submit your PPR and other required reports during the 36-month project period for each of the 3 12-month budget periods to include a non-competing continuation application. Grantees must have subrecipient or subcontractor agreements in place within 30 days of grant award. Grantees also must have a plan to monitor subawardee claims, address them seriously, and document their corrective actions. And in general, the requirements that apply to the prime recipient or grantee organization, including public policy requirements, also apply to the subrecipients and contractors under this grant. So next, we'll discuss the roles and responsibilities of the APP program office. So the program office reviews applications and programmatic reports, responds to programmatic and technical aspects of the grant, ensures the amount to be awarded to grantees are consistent with the current statutory requirements, and monitors grantees' performance. So continuing on with the role of project officers here, project officers are the contact person for any programmatic changes or updates. Below are examples on when you should contact your PO or project officer. You should contact them for any programmatic requirements, program modifications or changes in scope, budget revisions, change in key staff positions, program progress reports, monitoring and site visits, and any technical assistance that's needed. The main objectives are to assure the project is in compliance with the terms and conditions in the authorizing legislation, to discuss the program's development and observe the project during implementation, and provide programmatic, financial, and evaluative guidance and technical assistance as needed. And the project officers will provide prior notification to grantees when in-person or virtual site visits or site monitoring visits are scheduled. So project officers will provide ongoing technical assistance and review grantee performance through emails, webinars, conference calls, virtual meetings, and site monitoring visits as well. So now Ronnie Brooks with the Office of Grants Management will provide you with information on the fiscal management of your grant. Thank you all, and congratulations again.
Good afternoon, everybody. Again, my name is Ronnie Brooks from the Office of Grants Management. I'll be completing the grants management portion of today's webinar. The role of the Office of Grants Management, we're responsible for the fiscal management and administration of the grant award to ensure compliance with applicable laws, regulations, policies, and procedures, and technical aspects of grants and fiscal monitoring. We provide guidance on fiscal requirements related to grant awards, terms and conditions, post-award changes, reporting, and closeout procedures. And we do work hand in hand with your project officer to help you with anything that you need. Even though we handle the fiscal portion, we do work together. Please contact the Office of Grants Management for any of the following: requesting amendments to the original grant application, such as changes in key personnel, budget modifications, carryovers, and no cost extensions. Clarification of budget issues, particularly if you have questions about allowable and unallowable costs, and for guidance on submitting fiscal reports and other official correspondence. Grants policies and regulations, the HHS grants policy statement, which is very important, provides general terms and conditions for all HHS discretionary grants and cooperative agreements. And that 45 CFR Part 75, uniform administrative requirements, cost principles, and audit requirements for HHS awards. OMB Circular 2 CFR Part 200, uniform administrative requirements, cost principles, and audit requirements for federal awards, and then the website to find all that information. Payment management services. Payment management actually handles your physical bank accounts. They are part of the HHS Program Support Center, which is separate from ACF. PMS provides the payment and accounting system for all HHS grants. They handle a lot of accounts, even for some non-HHS entities. So grantees are responsible for requesting payments and reporting disbursements to the payment management system, which we'll talk some more about. And the grantee has to spend funds within 72 hours after requesting a drawdown. That's very important. PMS requires quarterly reporting via their system. You can visit the payment management website, and there is the website address for quarterly financial reports, due dates, and find your PMS accountant contact for PMS access assistance or any drawdown questions. You can also find a lot of other good information on their website that will help you along with your accounts. The phone number listed is for the help desk if you have any questions and They may be able to assist you if you can't immediately reach your accountant. Submission of federal financial status reports and program progress reports. Program progress reports, as Ricky mentioned, program progress reports are due semi-annually. Please submit reports to grant notes in grant solutions. Reports are due 30 days after the end of the reporting period. And here's just a sample. If your project starts on 9/30, then the first report covers the first 6 months, 9/30 to 3/31, and it's due 30 days after at the end of April. And then the same for the second 6-month report. Financial reporting, the SF 425 must be completed and submitted through payment management. The FFR report is an addition to the quarterly report with PMS. The 425 is due semi-annually, and at the end of each budget period, it's due within 90 days. So the semi-annual is due 30 days after the end of the 6-month reporting period, and then the final for any particular year is due within 90 days. Then there's just another sample. If the first 6 months report is due April 30th, the second report is due October 29th. And the last report, the annual report, is due December 28th. Those last two, the second report and the annual report, those dates are a slight change within a day or two. And we had to update this information because payment management, those are the cutoff dates that they show in their system. And what we didn't want to happen is if we put through the end of the month, it's like through October 30th or the 31st, or the end of December, the 30th or the 31st, you could possibly get a delinquency notice from payment management, and we didn't want that to happen or anybody to get worried. So please just update your records with those due dates, because it's 30 days from the end of the reporting period. So if it ends on September 29th, then it's due October 29th. The SF 428 report, which is the tangible property report, if it applies to you, is normally due annually, and please submit that through grant notes and grant solutions. User roles in grant solutions, only the authorized official and principal investigator roles in grant solutions. Those are the people that have access to make any requests or upload documents. Other roles have read-only access. OGM, the Office of Grants Management, is responsible for ensuring that the AO and PD for grants have access to grant solutions. So please direct your questions to the Office of Grants Management, whoever your grants management specialist is. If you need to change a person who's authorized to access the system, or you have a change in your AO or PD, so that we can update those records, so whoever's supposed to have access will be able to do that. Grantee control over submission of post-award documents, and contact OGM with any questions on any of that, any roles for your staffs. Post-award changes requiring prior approval, change in scope or objective, change in key personnel, transfer of funds budgeted for participant support, no cost extensions, significant rebudgeting, or need for additional funds. All of those things are samples of things that require prior approval. Budget modifications, please submit a request as an amendment in grant solutions. The required documents are a cover letter signed by your authorized official, the SF 424, which is the application for federal assistance, where you just fill out just all the general information about your organization, address, phone numbers, pertinent people, your authorized official, and PIPD, all that form. It has all that information. The revised 424A, which is the worksheet that you all submitted with your original applications, where it's got the boxes for each line item, revised SF 424A, and a revised budget narrative and justification and any other documents to support what it is that you're trying to do if that's necessary. Your letter should talk about why you need to rebudget any monies and what's happening so that we can know what it is that we need to review and approve. Please know the website here for Grant Solutions training video, which has instructions on post-award amendment submissions and how to do that. Those videos are very good, which will help with, any questions that you may have in uploading amendments to Grant Solutions. Please note, prior approval is not required for budget modifications when the federal share of the award exceeds $250,000 and the amount that you'd like to transfer between and among line items is below 10% of the awarded budget, or if the federal share of the budget is below $250,000, any amount that you all would like to move among line items is below 25% of the total awarded budget. If you find that you're going to make a budget revision or modification and that it falls in one of these categories where it's not approved, not prior approval isn't necessary, please just make sure though that you let us know, let your project officer know, let the grants office know in writing. Thank you. Carryover of unobligated balances. These funds are to be used to complete unfinished activities from the prior year and the prior budget period, and the cost should have been reflected in the approved prior year budget. So if you find that you're getting to the end of a budget period and there are things that you're not going to be able to finish, objectives that were already approved in your application or in your award, you can request to carry those funds over to the next budget period so that you can finish those activities. Those monies cannot be used to start anything new. They have to be used to complete unmet objectives from the year in which the money remains. Carryover balances should be requested as soon as possible after the submission of your annual FSR. They must be submitted via managed amendment in Grant Solutions. And again, if you have any questions, you can contact the grants office. You can contact the Grant Solutions help desk and also check out the videos that they have, which will help you with figuring that out. Again, the required documents, a cover letter letting us know how much you need to carry over, why you need to carry over the money, what hasn't been completed, the SF 424 and the 424A. When you complete your SF 424A, in the first column where you all have had your original budget amounts in each category, keep that there. And in the next column is where you're going to put the carryover budget, and so that we can see the difference between the two. You're only submitting the revisions based on your carryover budget. Line item budget justification showing the carryover amount only, which I just said, and the annual 425 showing your unobligated balance on line 10H. We're going to check the payment management system. It's part of what we have to do, but we need to see on your 425 that you do have at least the amount that you're requesting to carry over, and all reports have to be submitted. You have to have all your financial reports in so that we can just make sure that everything is in order as it should be. No cost extensions are requested to complete activities of the grant in the final year of the project period. Requests are not approved merely for the purpose of using unobligated balances. Requests should be made 45 days prior to the end of the project period, and our one-time extensions up to 12 months. The 45 days is really important if you can. Sometimes it's not possible, but as much as possible, please try to get it in, request in for extensions 45 days prior to the end of the project period, because then that gives us time to review everything and to get it done and in the system so that you have that extension before your project period actually ends. Extensions can be up to 12 months. You may think, oh, that you only need, let's say, 3 months, and then you find out that that's not enough time and you need another extension. That can be possible, but it's still, you can only have an extension that totals 12 months. So if you've already used some of that, if you request another extension, those extensions cannot total more than 12 months altogether. The no-cost extension does not authorize additional spending or any new activities beyond the purposes consistent with the original award. Please follow instructions and grant solutions for requesting a no-cost extension. Requests will include, again, cover letter, very important, why you need the extension, how long you need the extension. So the revised expiration date or proposed expiration date, supporting reasons for the request, the remaining balance that you have, the SF 424, and make sure that all SF 425s and federal financial reports, the 425s and program progress reports from previous and current budget periods have been submitted. Okay, that's it for me. That completes all the information I have for you all today from the Office of Grants Management. On behalf of our office, congratulations to you all on your awards, and we wish you success as you work hard to serve your clients. I'm now going to turn it over to Jerry Regier.
Thank you, Ronnie. My name is Jerry Regier, and I am the project director on the contract that we refer to as SRAE Performance Analysis Study, or PAS, and so it's related to the performance measures. The purpose of performance measures is to monitor program implementation and progress, provide timely feedback to grantees for ongoing program improvement, and report to FYSB, ACF, and HHS leadership. The benefits of performance measures to grantees: this will arm you with data to share with stakeholders, facilitates monitoring and continuous quality improvement. You can monitor progress toward program goals, identify training and technical assistance needs, provide data to advocate for continued funding and sustainability. And you can get this data from the dashboard that is created for the performance measures. And there have been some trainings on that that would be housed on the SRAE PAS website, which we'll share with you in a minute. And that would orient you more to the dashboard itself. And now I'm going to turn it over to our partner and subcontractor, Laura Halsey, who is the project director on the subcontract with Mathematica. Laura?
Thank you, Jerry. My first slide highlights some differences between performance management and evaluation. Performance measurement, as shown in the first column of this table, examines inputs, outputs, and outcomes. Inputs are the resources that make the program possible, such as the amount of funding, the number and types of staff, and the curricula used. Outputs are the direct tangible products, such as the number of youth who participate and the number of hours of programming provided. Outcomes are the status of participants after their services, such as their perceptions of the program's influence on their behavior. Impact evaluation, as shown in the second column, measures the difference in the outcomes for participants and the outcomes for a comparison or control group that did not receive services. This contrast can establish a causal relationship between the program and its impacts. The SRAE performance measures fall into three broad categories. Measures of attendance, reach, and dosage describe the delivery of the SRAE programs, including the numbers of youth participants, the settings in which they're served, and how much of the programming they attend. Measures of structure, cost, and support for program implementation include the features of the SRAE programs, such as the curricula implemented and topics covered, staffing patterns and training, and funding. This category also includes program providers' perceptions of implementation challenges and their technical assistance needs. The final category of measures is participants' characteristics, behaviors, program experiences, and perceptions of program effect. Grantees will collect these participant-level measures through surveys administered to youth at program entry and exit. There are separate versions of the participant entry and exit surveys for middle school youth and for high school and older youth. The middle school versions contain a subset of the items in the high school and older versions. In particular, middle school versions do not include questions about sexual behavior. As shown on my next slide, the frequency of data submission and reporting periods vary by category of performance measures. The measures shown in the first two rows, measures of attendance, reach, dosage, and measures of participant characteristics, experiences, and perceptions of program effects, are submitted twice a year, each winter and summer, with each round covering the previous 6 months of programming. For instance, during the summer 2022 data submission between July and August of 2022, grantees will submit data covering January through June of 2022. In the last row, however, we see that measures of structure, cost, and support for program implementation are only submitted once a year in the summer, and they cover a full grant year from October through September. So in July, August of 2022, grantees on this call will be submitting data for your performance measures data for the first time, and you'll be reporting on the entire October 2021 through September 2022 federal grant year for structure and cost and support, and providing 6 months of data for the other two categories of measures. We have planned a series of training events that will provide more details about the SRAE performance measures and guidance on related topics. The first webinar is scheduled for next Wednesday, November 10th, and will focus on the revised participant entry and exit survey measures. Following that live webinar, we will post 2 recorded webinars, one on working with partners and institutional review boards, and one about collecting survey data online for grantees interested in using that mode of data collection. On December 9th, we will hold a live office hours to answer questions that grantees might have about any of those topics. And then on January 13th, we will hold a live webinar about the SRAE Performance Measures portal, which grantees will use to submit the measures to ACF. Invitations will be mailed to grantees in advance of each event. And finally, on my last slide, I'd like to point you to the SRAE Performance Measures website that Jerry mentioned at the beginning, www.sraepas.com. On this website, you'll find more information on the performance measures, including guidance documents and recordings of past webinars for earlier rounds of grantees. However, keep in mind that revisions to the performance measures are currently under review by OMB, and those revisions are not yet reflected in the materials available on the website. Still, the currently available versions can be a useful resource because most of the revisions are reductions in the number of measures. So looking at what's available now can certainly give you a head start in preparing while we wait for OMB to come through with final approval for the revision. And now I am happy to pass the presentation to Susan Zief.
Thank you, Laura, and welcome everyone to this orientation meeting. Congratulations on your award. If you are a repeat grantee, we look forward to continue working with you. And if you are a new SRAE grantee, I'd like to take some time now to tell you a little bit about the national evaluation, which is a separate effort from the performance measures. I direct this project with my colleague, Heather Zaveri, and also our partners, Public Strategies. Our partner, Public Strategies, where Jerry Regier, who you've heard from and will hear from again after this, is the project director on the public strategy side. So there are three main parts of the SRAE national evaluation. The acronym we use for it is SRAENE, or SERENE. The first is a descriptive study, which collects information across all grantees. The second looks more narrowly into the specific components of programs that are considered critical for program success. And the third provides data capacity building and local evaluation support to all of you. The overall goal of the national evaluation is to get actionable, oriented evidence out into the field, engage with all of you, including experts and other key stakeholders, and to uphold ACS evaluation priorities. So I'm first going to describe the National Descriptive Study. This study tells the story of SRAE nationwide. So we began this study in 2020 with grantees funded at that time receiving a survey to document what their program plans were. It is called the Early Implementation Study. Sometimes you'll see it referred to as EIS. We deal a lot with acronyms on this evaluation, but there will be a series of briefs with the findings from that EIS survey that will be coming through within the next month, and you will all be sure to hear about the release of those briefs. Then about a year from now, we're going to collect data on what we call the nationwide study. This is a chance to return to the field across all funded grantees at that time and learn about your experiences delivering SRAE programs. We're also going to quantitatively examine the relationship between features of program implementation and outcomes across all grantees. While not planned at the beginning of this evaluation in 2018, we also were in a great position to tell the story of programming during COVID. If you were a grantee last fall, you conducted a brief survey so that FYSB could better understand the extent of program disruptions. This fall, we are going to return to the field with more in-depth qualitative interviews with returning grantees. So if you are a brand new grantee, you won't be participating in these interviews because these interviews will really ask questions about more in-depth questions about changes within your organization and your programming due to the pandemic, what's been improving, and what silver linings you might be carrying forward into your 2021-2022 program plans. These interviews will be conducted on a virtual platform so that the participating grantees can come online and answer questions at their convenience. And now we're moving on to the program components impact study. This is the way traditional program evaluation works. So let's just say we were interested in evaluating the program TOP, or Teen Outreach Pregnancy Prevention Program. That is typically done through a program evaluation where you randomly assign youth to receive TOP or not receive TOP. And then you get an output. Is it thumbs up, effective, or thumbs down, not effective? But you don't know much about why a program, any program, is or isn't effective. And so that is why the federal government has turned to looking at program components instead of the entire program. So what are program components? Well, ACF defines them as essential parts of a program that are critical for achieving the program goals, and they're also small, irreducible. So for example, the curriculum is certainly a component, but if you think you're evaluating a curriculum, you're also evaluating any supplemental activities that are being provided, who the facilitators are, how they've been trained, and the mode of facilitation. So these are just examples of what we mean by program components that make up that black box that we don't unpack during a traditional program evaluation. So while a program evaluation more traditionally may answer the question, is the program effective? With program components research, we ask questions such as, why is the program effective? And how can components of programs be improved? And it's the how, which is going to be really important for the SRAE national evaluation. For this component of the study, we first identified what program components we were going to specifically focus on. And then the second step is to improve upon those components. We met with stakeholders and program experts to identify, and now we're at the stage to study the implementation and outcomes of these selected components. So what did we select? Consistently across all the conversations we had with experts and stakeholders and program developers in the first year of the contract, we heard that facilitation is the key for having SRAE content resonate with youth and for them to use the program to change their attitudes, beliefs, and ultimately behaviors. That facilitation is the linchpin. But there is not a lot of evidence on what makes the best facilitation within the context of SRAE programs. So we can fill a gap in that knowledge. And since facilitation is something that applies to all of your programs, what we find can be relevant to the entire field. What we did was we identified 2 facilitation strategies that were coming out of a development phase that were developed and tested on a very small scale. And we're going to begin very soon to test the feasibility of replicating each strategy kind of through 2 small proof of concept pilots. I'm going to briefly describe each of the strategies. But as you may have an opportunity to participate in either of these efforts, you'll learn a lot more about them. So the first one is using co-regulation with youth. And the premise here is that youth need skills in self-regulation in order to promote positive relationships and avoid risky behaviors. In fact, as you know, SRE legislation requires programs to address self-regulation. So with this strategy, we are going to use 6 co-regulation strategies that were developed and tested with a small number of grantees and replicate them with a small number of other grantees and replicate them with a small group of SRAE grantees. The second strategy we call facilitator foundations. And the premise here is that youth behavioral change is not possible without program facilitators understanding the predictors of behavioral change. And that facilitators then play a role in assessing youth progress on predictors. And what do I mean by predictors? Well, prior research has identified attitudes and beliefs that can predict the avoidance of sexual risk. And those are listed here on this slide. This approach was actually introduced to SRAE grantees on a couple of occasions during prior T and TA topical trainings. The link to those trainings is here. And so when you get a copy of these slides, which I think Julie mentioned earlier, you'll have a resource if you wanted to learn more about this strategy. Okay, and finally, I'm going to conclude with the arm of the evaluation that every grantee has an opportunity to take a part of, and that's data and evaluation support. First, we offer local evaluation support. Our goal here is to support you in conducting high-quality, descriptive, and impact evaluations. If you have proposed an impact evaluation, we are going to be in contact with you shortly to see how we can help. And then we have resources on our website, which I'm going to show you in a moment, that are germane to all grantees conducting an evaluation, from design to measures to best practices in data collection and soon analysis and reporting. We provide a variety of activities, including individualized support, which I just mentioned, conference calls, webinars. You'll see a lot of activity through our email account and on our website this year. We also offer opportunities for grantees to improve their use of data for continuous quality improvement. We recently just conducted a pilot using some CQI templates and toolkits, and they will soon be rolled out to all grantees based on what we learned during that pilot. Other data capacity building topics have included logic models, implementation evaluation, which will also be a big topic in the coming year, how to measure the cost of your program, and data collection and storage. And in particular, data collection as programming moved to virtual. These are 2 pages from our website. On the left is the landing page where it says a little bit about the project and also gives you the most recent resources and updates that have come through the website. The frame on the right shows what you will see if you click on the Resources and Webinars tab, where you can search and filter on the type of resource or the topic that you are looking to get some information on. All right, so I'm going to sum up what's really probably most relevant to you as grantees coming out of the national evaluation in the coming year. Number 1 will be the briefs I mentioned that are coming out of that very first cross-grantee data collection effort. Then there will be, if you are a returning grantee, virtual interviews related to how COVID has affected and may continue to affect your programming. And then about a year from now, a new data collection for the second phase of the large descriptive cross-grantee study. For the program components impact study, we are about to begin a small pilot with just a couple of grantees to replicate the 2 strategies I described, and grantees that meet some study design criteria will be asked to volunteer. Then we plan to move to a larger scale impact and implementation study of the 2 strategies, where a multitude of grantees will be able to self-nominate themselves to participate. And we're also concurrently participating in some new development work collaboratively with a small number of grantees to broaden the reach of each strategy. Now, in data and evaluation support, if you plan to conduct an implementation, or sometimes often called descriptive evaluation, please consider volunteering for an upcoming pilot, which we are going to launch, which will really help us to refine and further develop a toolkit that grantees can use to systematically collect and analyze implementation data. And then, of course, I mentioned if you're planning to conduct an impact evaluation, you can receive individualized support. But I really encourage you, if you have any question about data collection, evaluation, continuous quality improvement, please contact us and we'll get back to you shortly. And if you go to the next slide, I believe that is our contact information slide. So I believe Owen is going to put this in the chat later, but this is our project email address and our project website. And with that, I'm going to turn back over to my colleague, Jerry Regier at Public Strategies. Jerry?
Thank you, Susan. Again, my name is Jerry Regier, and I'm the project director on the SRAE training and technical assistance. So I hope you're keeping all this straight. This is the 3rd resource that and contract that relates to you as a grantee and to your program. Public Strategies has been doing technical assistance in government contracts for over 20 years, and we are experts in program implementation, research and performance measurement, and public policy. We're headquartered in Oklahoma City and have some staff in Washington, D.C., Colorado, Ohio, and North Carolina. Our leadership team is myself, and you will hear some of these names as you get involved with us during the next months. Scott Roby leads our task 3, which is the individualized technical assistance. We have a subcontractor on this project, Ascend, and Marianne Mozak and Tracy Pike are involved also in providing technical assistance to grantees, as well as Marianne, then on the next part of this slide, is part of the team that leads the topical training. And then Michelle Watson is the one that keeps us all together as the project manager. And we have some senior advisors as well. Additional TTA personnel that you will get to know over the months are listed here. And then we also use consultants for some of the webinars or to assist with tip sheets. And so if they have expertise that we think and FYSB thinks will be advantageous to you as grantees, then we bring them in to provide that. So the SRAE TTA activities, and I'm going to just give you 4 of the main areas that we provide training and technical assistance. And as I do that, I want to talk a little bit more about just the technical assistance and how you go about asking for that. As a grantee, you have a project manager, project officer, I should say. And that project officer is the person that you would go to and say, I would like some technical assistance on such and such. And that technical assistance can actually be on almost anything related to your program. Let's say you want some assistance in choosing a curriculum, or you want some assistance in knowing how to recruit and connect with schools as partners in your area. Or you want some assistance on how you can improve and increase your social media presence. So just about anything that you can think of in your program, you can request that technical assistance. And requesting it does not communicate to your project officer that you are weak or you don't know how to do something. It rather communicates that you want your program to be to raise the bar in a certain area, and you're willing to have some help. And so we really encourage you to take advantage of this because it's free, it's available, it's part of your grant, and we are here to provide that. So the first thing is that second bullet there, individualized TA to grantees. And our team is anxious to provide that for you. But again, you contact your federal project officer to request that. The second activity is the topical training. And our first topical training will be February 15 through 17. So you can mark those dates. And this is delivered virtually in 3 half-day formats. And usually there's at least a couple of grantees that can come from each program. Sometimes, since it's virtual, FYSB allows for more than 1 or 2 coming from a grant, and it may be even as high as 4 people. So you will find that out as we move towards the information related to this particular topical training. We have submitted some topics for FYSB to consider. And FYSB has some topics that they're thinking about. And so we should know in the next week or so what the topic will be. And then we will be sending out information on that soon so that you can begin your planning. And the other areas that we provide technical assistance is off-site TA, and this is where we provide tip sheets and some webinars like the one that we're on right now, and some cluster calls. Cluster calls are the opportunity for a small group of grantees to get on a call and interact with one another. It's generally perhaps around some kind of task or topic, and it's a great opportunity to share and learn from your peers. Tip sheets are built around topics that we think will be of interest and help to you as a grantee, and so we'll have several of those available through the next months as well. And then the last activity I want to highlight is site monitoring. And this too is going to be virtual. Over the next 6 months, we will be doing 7 site monitoring visits. And FYSB has just made the choices of who those grantees will be, and your federal project officer will be in touch with you shortly. Because we are looking at doing about 3 of those that week of December 13 through 17, and then 4 more during the January 10 through 28 period of time. And let me just say, if you are a program that is chosen as a site monitoring visit, don't be afraid of that. Don't be nervous about it. It basically is an opportunity for you to do some looking at your own program and interact with both us and your federal project officer to see if there are any areas that could potentially be improved. These are some resources and additions that can be added, and it looks like our black box has appeared again. For further information, you can contact Public Strategies at srae.tta@publicstrategies.com. And we will probably post those in the chat room also so that you have that link. And that's a good way to let us know if there's any way that we can be of assistance. And then for additional resources, you can go to the exchange at that link. And that is what you're going to hear about next. And so I'm going to introduce Owen Burns, who is the Office of Communications at ACF and FYSB, and he will be talking about the exchange. Owen?
Thanks a lot, Jerry, and good afternoon, everybody. Hope you're having a great day. As Jerry mentioned, I'm going to talk a little bit about the exchange as well as a site that Debbie mentioned here at the beginning of the orientation, We Think Twice. By a show of hands or thumbs up, if you guys wouldn't mind, use the little reactions feature down at the bottom right of your Zoom screen here, and give me a thumbs up if you've visited the exchange or are familiar with the exchange. Either way, if you thumbs up or if you're not familiar with the exchange, I definitely would encourage everybody to make a regular habit of visiting and becoming familiar with the site. The exchange is a destination site for all things APP, TNTA related. I'm going to show you a video here. It's about 3 minutes long, so everybody grab a little bit of popcorn, and I'm going to actually let the video do most of the talking.
Are you an adolescent pregnancy prevention or APP grantee receiving funding from the Family and Youth Services Bureau? Do you want to take your teen pregnancy prevention efforts to the next level, but unsure of where to start? The Exchange is the place for you. 3 years ago, we interviewed APP grantees like you about the types of resources and tools they'd like to see on a website to support their programs. A few months later, we launched the Exchange website, which includes resources, an event calendar, blog, comment wall, and a tool that allows you to customize promotional materials. Have a question about human trafficking? Want to find the recording from a webinar you couldn't attend? On our resources page, you can find what you need quickly by using our format and topic filters. Once you select a topic, hover over the image to see the format types like infographics, webinars, podcasts, and online trainings. Want to share a resource with your colleagues and networks? Just select Share to post to your Facebook or Twitter accounts. As APP grantees, you look at teens' health holistically, their relationships, mental health, substance abuse, and physical health. With our event calendar, you will find upcoming adolescent health observances and how to get your program involved. You'll also find the dates and information for in-person trainings, webinars, and conferences offered to APP grantees. Want to create your own infographics, web badges, and tip sheets on teen pregnancy prevention and other adolescent health topics, but don't have time? The Studio tool is your answer. With the Studio, you can add your organization's logo to materials that have already been fact-checked and approved by the Family and Youth Services Bureau. Within minutes, you'll be able to download and share personalized materials to help increase the visibility and impact of your program. To access the Studio tool and other materials developed exclusively for APP grantees, you need to create an account on the Exchange. If you are the primary point of contact for your grant, then you must register before any other project staff can access exclusive content. Each grant can only have one primary contact. Registering takes less than 5 minutes. Just click Register in the top right corner. Select APP Grantee Point of Contact. Then complete the form with your name, grant number, email address, organization, and funding type. Once your account is approved and you set your password, you can add project staff by going to Account and then My Grants. Just enter their names and email addresses. Then select Invite, and they'll immediately receive an email granting access to the site's exclusive content. We know you are actively focused on helping youth avoid obstacles to success and prepare them for bright futures. Don't waste time searching the web for resources. Visit the Exchange, your one-stop shop for content and features designed to enhance your APP program.
So as you can tell from the video, there's quite a lot of information up there on the Exchange. And some of the top pages definitely make a habit of visiting the resource page. Use those filter buttons at the top, or the filter functions at the top that'll help you pinpoint your search a lot better. The event page is where we list things like the conferences, topical trainings, other training events, health observances. And then you've also got the Grantee network, which is, if any of you do know the Exchange website, it used to be called the Comment Wall. It's now called the Grantee network. That is accessible by login only, and so anyone who's new to the Exchange will need to sign up for accounts, and there'll be some information coming out for you guys on that. Right here on the graphic, you might see it called the Comment Wall, but it's going to be called the Grantee network now. Look for that on your main nav. Here are a couple of ways to, some pointers on getting TNTA. Obviously, contact your federal project officer, and again, utilize the Exchange to do some looking around and see if you can't find some help for yourself there. Please take note of these 3 bullets here. This is the way that we, the APP program, and our contract partners communicate from the perspective of notifying you about conferences, events, topical trainings, things like that, is through email and email marketing. So we'd like you to put these addresses or these domains in your safe senders list on your email client. If you're not familiar with how to do that, you can Google it, or you can just type in that safe sender into your help box in your email. The other website I mentioned was the We Think Twice website, and the We Think Twice website is actually a site that we support and maintain that is targeted to reach our youth audience. And We Think Twice is specifically targeted to youth, and it offers our visitors inspiration and motivation, as well as tools that help those youth to make good decisions and strive for optimal health. We use the term a lot, and you'll hear it, that this site was designed with youth for youth. which a demonstration of that is our recent Q&A with Dr. Fauci, which you'll find on the We Think Twice website. The idea for that, the content for that, and the execution of that all came through input and advice from the youth themselves. There are questions the youth asked, and you can, as I said, see that on the We Think Twice website. This slide shows a little bit of the ecosystem of the We Think Twice website. It started off with an Instagram page. We added the website as well as a Facebook page. On that website, you'll find a lot of digital products, including games, tip sheets, infographics, things like that. And there is, I mentioned, the youth that helped us with the Dr. Fauci interview. That's through a youth community called We Think Twice Insiders, which are a group of youth that we leverage and get their feedback and input on all of the aspects of the site, from design to content and more. There's also a set of tools for youth serving providers. So folks that are here on this call, those aren't actually located on We Think Twice, but you can find them on the Exchange, and they're tremendously helpful, and they're really functional and interactive tools. Next slide, please. We kind of hit this slide once already, but I just point everybody to the last bullet there. The design or the idea behind We Think Twice is to support the goals of the APP program and grantees, and again, help and encourage youth along the way. And one more, I'm going to show you a couple of slides with some accomplishments that we're pretty proud of. One is our growth and reach of our the We Think Twice website. I've said this a couple of times in the last few days, but over the last, say, 18 months, the Instagram site has actually increased in followers by 150+%. We've got, as you can see, quite a lot of impressions and reach here. The We Think Twice website, similarly, being who the site and campaign is targeted for, the Instagram is the front runner, but the website does a very good job as well right behind there. Next slide, please. And here's a couple of, cheerleader graphics for us. These three on the left are the top 3 posts from our Instagram page, and then the top 5 web pages on the We Think Twice website. And you'll see some examples of the types of content we have here. Different quizzes. We have motivational quotes, which are submitted by youth. There's playlists. There's poems. There's art. All kinds of inspiration for our youth. So, and here's this slide just tells you how to find us. We're at We Think Twice is our handle on Instagram and Facebook, and obviously WeThinkTwice.org is the website. If any of you guys have youth that are that you think would be encouraged by or interested in joining the We Think Twice Insiders, go to that homepage and hit the Take Action page that you'll see in the main nav, and they can sign up right there. That's it for me. I did this yesterday too. We just talked about that, the Take Action page there. I mentioned resources for youth serving providers. So here's 3 examples of those: creating safe spaces, the tips for virtually engaging parents, and the community saturation source book. There's actually also a community saturation toolkit. Again, these are available on the web, on the Exchange, and I'd definitely encourage everyone to go take a look at them. And here's where I'm going to turn it over to Labrita White. Thanks, everybody.
Thanks so much, Owen. We are down to 0 minutes, but I will say good afternoon, everyone. I'm Labrita White, Program Manager with the Adolescent Pregnancy Prevention Program. And really quickly, we'll give you some closing remarks. Due to the essence of time right now, we will forego Q&A, but invite you to contact your assigned project officer should you have questions. Do want to be cognizant of the lateness of the time and the hour. But again, good afternoon to our General Departmental SRAE grantees. Congratulations on your FY 2021 grant awards. Must share with you and say your projects make up the 6th cohort of GDSRAE federal grant recipients. And with excitement, we look forward to a successful partnership throughout your 3-year project period. I know you've received a significant amount of information, so again, I'll be brief with my remarks. I first want to thank our federal staff and contractors for presenting essential information during the webinar and would reiterate that they stand ready to provide you with support and assistance as you implement your sexual risk avoidance education projects. On behalf of the APP program, please be reminded that the federal project officers and our contractors are here to provide you with training, technical assistance, but also whatever else is needed as far as support in accomplishing the overall goal of teaching youth to make healthy decisions and to avoid non-marital sexual activity as well as other risky behaviors. We know there may be challenges along the way. However, we also know that open and transparent communication, innovation, creativity, and cooperation will lead to inevitable accomplishment of the goals of the GDSRAE program. The accomplishment of goals and success is also contingent upon your partners, your contractors, your subrecipients that are working alongside you. So I encourage you to invite your partners to participate in all relevant training and technical assistance sessions that will be available to you on programming, data collection, and evaluation. You're further encouraged to review the recording of today's webinar, as well as to share the recording with all staff affiliated with your project, and to refer to the grantee guidance document that you received from your federal project officer, along with an introductory email probably several weeks ago. Between the webinar presented today, the grantee guidance document, the plethora of resources and websites that have been shared with you on today, you should have a good amount of information to really support you in the planning and implementation of your projects. It's really important, and I always want to stress with grantees, those partners, your direct staff, your management staff, your support staff on your projects. It's really important that they know and understand your project. Not just being employees to your organization, but they are your partners in successful implementation of your grants. So I encourage you to share with them the notice of funding opportunity, your grant application, as well as all of the information that we're sharing with you today, and any new training resources and information that we make available to you in the coming weeks and months. Again, was a whirlwind of closing remarks, but I just want to say thank you for participating in today's webinar. We will not, again, move forward with question and answer, but again, congratulations. Thanks for your participation. And at this time, I'm going to turn it over to Julie Marchbanks to share with you final logistics as we close out today's webinar. Again, take care and have a great evening. Julie.
Thank you, Labrita, and thank you all for attending. Thank you and have a great day.